Okay. All right. Hi, everybody. My name is Jamie Alban. I'm excited, kind of excited, to be talking about traumatic brain injury or TBI in veterans. So, what exactly defines a traumatic brain injury? So, it kind of is self explanatory. It's trauma to the brain and to the head. The way that clinicians measure is based on a scale of severity. So, in the small little chart that I have to the side there, this is just representing the amount of traumatic brain injuries reported to the Department of Defense in 2014. So, this is not on the larger scale that I'm going to talk about. So, you have your penetrating traumatic brain injuries, which is that that something has penetrated the cranium and gone through the skull. You have your severe, moderate, and most commonly reported is mild. So mild is actually what we would call a concussion. It's the most common amongst the severities and usually can dissipate within a matter of days to weeks. And then unclassifiable can have many reasons behind it. So some of the symptoms of a TBI, and again, it goes case by case because not everybody presents with the same symptoms. Some of the more acute things that you see are loss of consciousness, sensitivity to light and sound, convulsions, nausea, vomiting. I know that I've heard before if you ever suffer, if you hit your head and you start throwing up, then that's usually a sign that you have a concussion. Vision impairment, blurred vision, double vision, most commonly headaches and fatigue. So those are one of the things that are kind of a classic symptom. But not only are there those more acute problems, but over time you can see cognitive issues come up. So that includes memory loss. That happens a lot with not remembering what happened that led to the traumatic brain injury. Something called alexia, which is the inability to comprehend writing. Um, and one of the more dramatic symptoms that we see that really affects functioning is mood changes, personality shifts. That's a big one. And then your depression and anxiety and suicidal ideation. So it years 2000, excuse me, the years 2000 to 2019, there were 415,000 reported cases of TBI, most occurring within the military, most occurred during combat or training. And part of this is because we had the war in Afghanistan and the war in Iraq happening during that time period, and we were seeing a huge increase in traumatic brain injury because of the implementation of IEDs were being used so much, and hidden explosives and landmines and the IEDs. So there were reported out of the 415,000, there were 299,000 cases that came from the Army, around 69,000 from the Navy, around the same amount in the Air Force, and then over 70,000 in the Marines. The most common age as of 2018 was ages 30 to 39 that were the most commonly reported, which would, of course, coincide when the war in Afghanistan and Iraq were happening. As far as race and ethnicity, most of the people affected by TBI were white and Caucasian, 64 to 66%. 12 to 14% were non-Hispanic Black, 9 to 10% were Hispanic, 7 to 9% were the Asian community, and then 2% were American Indian or Alaskan Native. So I had a hard time finding an actual um, number of percentages of women versus men. The samples that I did find were only limited to a couple of hundred of veterans with TBI, and they purposely included more females in that study. So I really didn't feel like it was a good example, but I did find a broader statistic that said that men are more susceptible to TBI than women because they engage in more of those high risk activities in the military. They're more likely to be combat veterans and to be around all of those things that can cause TBI. So part of the problem or part of the challenges of diagnosing TBI, well, there's many reasons. One is the late onset of symptoms, which I'm actually going to dive in a little bit. Another is that symptoms can often mimic PTSD, which sometimes they go in excuse me, sometimes they go hand in hand, where TBI, if someone with a TBI is way more likely to have PTSD because of the events that led to the TBI. But the problem that sometimes occurs is symptoms of PTSD are actually symptoms of TBI, and you really have to know what symptoms you're treating and for which problems they are occurring for. Because an example that I read was that you can't treat certain symptoms with psychotropic drugs because they can do the opposite effect. So you have to be careful in determining whether depression is as a result of TBI or PTSD. Another challenge with TBI and really the veterans overall is their access to resources. When I was looking for limitations that veterans have, a lot of them were unanimous in saying that those that are in more rural settings had a harder time accessing resources. Or I know a big thing right now is telehealth, because especially since COVID. But one of the challenges with that is making sure that people have devices that they can connect to telehealth, as well as people needing internet access. And then people in more rural communities have less options available for healthcare, and their closest VA healthcare systems are not always the closest. So definitely can be challenging, especially for ones who might be hesitant to get care in the first place. If they have to go out of their way to seek it, it may deter them from getting the treatment they need. So part of what makes TBI unique in veterans specifically, again, I had mentioned the late onset of symptoms. So sometimes things like those personality shifts or those mood swings might not happen right away, and they may come about once a veteran has reintegrated back into society, they're back with their families. That presents a whole other set of challenges, which I'll discuss in a little bit. Um, but it can be really unsuspecting for families who think everything is kind of okay, kind of normal. And then you start to see this decline in cognitive function, executive function, decision making, um, showing signs of depression, um, having PTSD symptoms, having personality changes, being angry all the time. The irritability, again, could be a sign of PTSD, could be a sign of TBI. It's so hard to determine without having that specialized training and assessment. Um, and again, having that training is so important because the treatment options may look different for both. And then I also made mention that while traumatic brain injuries are not a new thing, the prevalence of it during the Iraq and Afghanistan wars have really presented a whole new, um, it really shows the need that we have to continue research, especially to analyze like the long-term effects of TBI and what that's going to look like down the road as people start aging. Are we looking at risk for early onset dementias, Parkinson's, more of those neurological functioning, neurological diseases, or disorders? How does it play a part? But I think because of the extent of TBIs that we've seen in the last 2 decades or so, we're going to be seeing a lot more research being published, which is a good thing, but also a sad thing because it's, affected so many people. So, factors that can affect recovery and management. So, I actually pulled both of these examples from our textbooks, and then did a little digging and looked for some research related to those. So one of the one of the references that I have on my page from Schaefer, Wilson, and Joyner, they looked at the correlation between having poor social support in veterans with a traumatic brain injury and their increased risk for suicide and suicidality or suicidal ideation. So uh, I don't find it surprising, but they did find that the less support that someone has at home, whether that be a spouse, parents, children, community, the less social support that someone has, they have a higher risk for having severe depression or suicidal ideation. They place a high focus on social support, and how assessment is so important at those beginning stages of a therapeutic relationship, because knowing what kind of support someone does have in place can really impact how well they're going to do in therapy, how well they're going to do after therapy, and how it's going to impact their recovery. They also found a positive correlation between having a stronger social support and better socio-emotional functioning. So being able to emotionally regulate a little better, having a stronger support system at home. So speaking of self-regulation, the text also mentions that being able to self-regulate is also just as important when someone is looking to recover from TBI. And they focus mainly on the cognitive aspect of TBI. So the cognitive emotional systems symptoms that one can experience can lead to difficulties with reintegration, social function, often leads to long-term disability. They find that people are having trouble with their families. They're having a lot of blame, doubt, shame, guilt, nervousness, anxiety. You might see them isolating a lot more, which can be challenging for families, which we'll dive into in a little bit. One of the things that, again, going back to the assessment piece and looking at the kind of resources, support someone has, and where they are at in their cognitive functioning, I found an assessment tool called the Brain Injury Needs Indicator, the BINI, and it measures the level of self-awareness in someone. And it's something that you give at the beginning of treatment and at the end of treatment to uh, determine whether or not the tools that they're given are helping with their self-regulation. I also found a study that assesses, it's called the Goals Oriented Attentional Self Regulation Program, or the GOALS program. And I think through social work, we learn that setting goals is so important for someone who is looking to make some kind of change. That is why someone goes to therapy. They're looking to make a change. So, setting goals is one of the most important tools that a therapist can offer. And this program is designed to increase their cognitive and executive functioning. And when they analyzed the results of the goal setting program, they did see higher self reports of people saying that they were a little more aware of their emotions, could handle them better, and had less depressive symptoms. So again, TBI not only impacts veterans, but it affects them, it affects their caregivers. I would say most of the time a caregiver is either a spouse or a parent, and a spouse may already be in a caregiver role and raising a family. They may have been raising children while a soldier is in deployment. So when they have to assume another caregiving role, that can really cause some strain in the family system, which brings me to my next point of the whole family unit can be affected by a TBI, especially with those late onset symptoms where, enough time goes by and you're starting to see a personality shift. You may not know how to handle that, or um, not be able to recognize that it's part of the TBI. And then, of course, children can always become susceptible to secondary trauma. So if they start to see, if mom or dad comes home with a TBI and a little time goes by and dad is no longer approachable or is isolating, doesn't want to spend time with them, gets mad at them, starts abusing them, starts having a substance abuse problem, children can ultimately suffer because of secondary trauma where they experience trauma themselves by the behaviors that are being exhibited. So in social work, I think it's really important, again, to address the needs of the whole unit or family unit. So, veterans, of course, deserve our utmost attention in being able to, on the micro level, veterans deserve that individualized treatment. Assessment is so important to figure out what exactly their goals are, what they're looking to change, what are the struggles, and then kind of basing the treatment off of that. And then of course pulling families in, because if veterans are impacted, then and they're seeking treatment, I would say it's safe to assume that something is not functioning well in their everyday life, whether and that could be with families. So pulling caregivers in, pulling spouses in, working on other important topics like marital strain, substance use, um, caregiver stress. So, on the meso level, focusing on that beyond the veteran, families, children, whatever is going to make the whole unit kind of more cohesive. And then social workers can also implement practice that aren't pharmacological. So by that I mean like relaxation techniques, deep breathing, yoga. One of the big focuses that I was finding in my research was about mindfulness, which I'm going to touch base on my next slide. I think it's my next slide. Yeah. But so staying up to date with more um, mindful based practices, I think is really important here, because you're dealing with such heavy emotions and experiences. I think they extend beyond a typical therapeutic relationship, and you really have to kind of go above and outside of the box in terms of those relaxation, non pharmacological interventions. So, some of the studies that I found related back to my last slide. One really interesting study was about mindfulness cognitive behavioral therapy, which MCBT. So that focuses heavily on that emotional dysregulation, and helps get get people back to being able to self-regulate, be more mindful of their intrusive thoughts, um, finding meaning in those intrusive thoughts, and understand why your brain has to process certain things in order to heal. Um, that is the whole goal of this MCBT, which is to help veterans understand why they're experiencing this. Um, Another piece of this, and I'm kind of referring back to my previous slides, but education is so important. So, educating, our textbook actually mentions educating veterans on symptoms and the normalcy of those symptoms so that they're not feeling so isolated in their experience. That was really important in recovery. And then, of course, going back to assessment, having strong assessment skills, staying up to date with assessment tools, being able to differentiate in symptoms and their and the diagnoses, and formulating good treatment based on that assessment. And I think that continues on to, um, past those initial ones, is, being flexible in your treatment and seeing what's working, what's not working, is something else popping up that needs addressed. All good skills of a good social worker. So, addressing TBI on a larger scale, the reason I put first is VA support. So, I feel like the VA really does try to meet the needs of such a large scale community of veterans. And with that, I mean, they have a ton of TBI resources on their website. I was sifting through them left and right. But I think, and the VA has also started a program to make uh, tech, what am I trying to say? To make devices and internet equipped devices more readily available for those rural based residents, um, veterans. And I think that they could always do better, and kind of expanding their VA specific health benefits to those rural areas where there is not as much choice as far as who to see. I think that they could always look into doing that better and focusing on those underserved populations. I've also heard that the VA has horrible follow through and wait times. So again, it's always something that can be improved on a macro scale, especially those underserved populations who can't really afford to have a lot of time go by before they're getting their care. So that's a big one. So in 2007, the VA required all military members who were involved in active combat to be screened if they for TBI. So it didn't matter if they were if they thought that they had a TBI or not. They are required to be screened. So I thought that was good. And then I threw this little video in here to highlight the Military Traumatic Brain Injury Initiative. It's a quick video, and they highlight on the importance of ongoing research for traumatic brain injury. They are under the Department of Defense, so they're a partner with the federal government, so they get a lot of good funding. But they're looking at more so like the long-term effects of TBI, which again is so important because of this huge influx of um, veterans who have had TBI in the last 2 decades. I'm so appreciative of the fact that they are focused on not only the clinical research when TBI happens, but how it impacts them when they have to reintegrate in society. So again, on a macro level, I think continued research is so important, even from social workers to come up with new therapeutic avenues and whatnot. It's always good to remain diligent, remain competent, and always continue to learn and research new things. So I believe that's it. Oh no, there we go. And then my reference page, and I think that's it. And I appreciate everybody. Um, Everyone did great this semester, and I look forward to watching some of your presentations.